Joining me now is Lily Eskelsen-Garcia, president of the National Education Association, Dr. Bernard Ashby, a cardiologist and Florida State lead for the Committee to Protect Medicare, and Ai-jen Poo, co-founder and executive director of the National Domestic Workers Alliance. Lily, it's so great to be together again. So nice to see you. It's been a while since we worked together, but so happy to have you on the show in this capacity. Sadly, it's under very poor circumstances. I mean, I couldn't think of anybody better to have this conversation than you. What do we make of this? I mean, I'm sorry. Go ahead, Lily. You're ready. I should have known. You're ready to jump right in. Go for it.
I am, but first, Tiffany, you're going to get me a copy of your new book because all of the people at NEA are talking about it, and I feel like I'm the only one left out. So you're going to
it's coming your way.
Copy of Say It Louder, yay, yay, yay! And can I just say, every time I hear Donald Trump or Betsy DeVos give medical advice, I just cringe. I just think, oh, please, please, under no circumstances should anyone be taking medical advice, or, by the way, education advice from Donald Trump or Betsy DeVos. That is not going to end well for children or other living things. No, we are not ready to just jump back in. No, kids are not immune, and they can get very ill. And by the way, evidence is showing that children can spread. Why in the world would you turn your neighborhood public school into your community's super spreader? The very first thing that people have to pay attention to when they say, is it time to open a public school, is you look at the guidance. And by the way, guidance isn't just like, well, if you feel like it. These are scientists. These are medical professionals saying, if you don't want to die, here's what you'll do. And the first thing is you don't open a school or a restaurant or really anything while the virus is surging. And because the Trump administration from day one has dismissed it and not taken it seriously and said it will magically disappear, there's never, to this day, never been a national plan to get the actual virus under control. All those countries that he throws out, you know, like Germany and Norway, they open their schools. We can too. The very first thing that happened was they had a national plan to get the virus itself under control and get down to below 5% of an infection rate in a community. In some of our communities now, it's double that. It's 10, 15, 20%. And he's saying it doesn't matter. Open the schools anyway. That is a recipe for disaster. People are going to die.
And just the indifference to children getting sick. Children getting sick. I mean, I don't know why anybody's surprised. If you can put them in cages, you wouldn't mind about them getting sick. But this is just outrageous. Dr. Ashby, I want to go to you because you're down there with Florida Man, and you're a doctor trying to counter just a lack of intelligence from leadership. And I think that's part of the problem. There's no centralized response to this. There's been a lack of leadership at the federal level. So much of these decisions are left up to local leadership, which has fallen short, to put it lightly. Talk to me about what is the case where children can go back? Because I will say I empathize with parents out there. A lot of my friends are parents, and they say, get these kids out of my house. But it's not to the extent that they're saying, I want to send my kids to a death trap. Is there any circumstance that you can see as a doctor, a medical professional, that we can send children back to school?
Hey, Tiffany, I peeped that you call Trump Florida Man. That's funny. But listen, we have to do our jobs, right? And Lily pointed out the obvious. It's a public health emergency, and we're not treating it as such. And we're offering, our leadership is demanding mandates for the wrong thing. So instead of mandating mask use, 24-hour turnaround time for results, less than a 5% positivity rate, they're mandating that we go to school even though it's not safe, that we open businesses even though it's not safe. Our priorities are backwards, and our leadership, especially Trump, is handing out misinformation like Scooby snacks. We got people like DeSantis eating it up and then actually applying that to our country or to our state and making bad decisions. And this needs to stop. I mean, until we get to a rate where we're all safe, let's not even talk about reopening schools and exposing our students, but also exposing our teachers. A lot of our teachers are part of the demographic that we consider vulnerable. obesity, diabetes, hypertension runs rampant in this population. And I just got off the phone with my big homie, Richard Johnson, who's a middle school teacher down in Broward, and he's totally concerned. I mean, luckily, we don't have to open up just yet in Broward and Dade, but he's completely concerned, and he's speaking on behalf of a lot of his colleagues, and they're all concerned, and they're afraid literally for their lives. So until we get this public health emergency under control, let's not even force these teachers and students to go back to school in a dangerous environment.
Yeah, I mean, I can't agree with you more. You've got Fed Ingram down there, president of the Florida Educators Association, who I think echoes your sentiment. Ajin, I'm so happy to have you on this panel because I know you're with Domestic Workers Alliance, but you're also a part of the supermajority, the other organization you founded, which focuses on women and the quagmire that we're in. Because even if you send students to school, it's also, or don't send students to school, forgive me, there are also parents who have the challenge of working. And so some of my friends who have full-time jobs, they're working, they're on Zoom calls. They also have trouble getting their kids logged in. You saw Atlanta Mayor Keisha Lance Bottoms tweeted out, "It's noon, I still can't get my kids logged in." Then you think about childcare, and this is something you focus on at Domestic Workers, nannies, people who are around, or you think about the educators, 76% are women. They're going home to husbands, their own children, older people. What's the solution here from a labor activist perspective even? We're asking people to put themselves in harm's way. What are your thoughts?
Exactly, we are. And Tiffany, it's so nice to see you in this role. I hope it becomes permanent. I just had to say that.
Thank you.
But to the topic at hand, I don't think it comes as any surprise to anyone that domestic workers and nannies, house cleaners, home care workers came into this crisis with a tremendous amount of insecurity. 82% of domestic workers didn't have a single paid sick day going into the pandemic. And we're talking about mostly Black and brown women who are mothers and caregivers themselves. Wages were incredibly low, so people were working paycheck to paycheck. There wasn't money to stock up on groceries or supplies. Now, in the context of reopening, what we have is a situation where domestic workers are having to do more with less. We're talking about a situation where domestic workers, who again are mostly Black and brown women, are having to help families navigate the uncertainty of the time, having to help families with online learning, having to keep their schedules flexible even though they have their own kids to support and take care of at home. And they're having to pay out of pocket for PPE, for regular COVID testing, for Uber and Lyft to get to and from work. Meanwhile, they're earning less. The wages have been depressed for our caregivers post-pandemic. So the burden of safety in this moment is falling squarely on the shoulders of the Black and brown women who have the least amount of power and resources to navigate this crisis. And it's completely unconscionable. And we're talking about people who are also parents. So they're working as caregivers. They're struggling to help the families that they support stay safe, but they also have their own kids, as you mentioned. It's an impossible situation.
It feels impossible to all of us here, but certainly to the moms and dads out there trying to navigate this space. So thank you for trying to make it make sense. And I want to thank Lily Eskelsen Garcia of the NEA. And I have to say, the NEA is run by 3 women of color. It's a historic-making organization. Thank you for joining me. Dr. Bernard Ashby, you are always a delight. So thanks for making the time this morning. And Ajin Poo, I hope we get to share a screen again very soon. Thank you guys for having this very difficult conversation.